Hi, my name is Ash and I'm a medical doctor. This presentation is on the bulletproof strategy that I have developed for the OET writing subtest. So this slide here is an overview of the writing subtest, which was given in my previous presentation, the introduction to OET. So this writing subtest, as you know, is a 5-minute writing assessment, profession specific, comes with a writing stimulus and gives you a task. And it's assessed on 6 different criteria. And then remember that I said that every letter has a start, a middle, and an end. In this presentation, I'll cover the middle, which is the purpose and purpose expanded, as described on the OET website. So the bulletproof exam strategy that I've developed for the OET writing subtest to help you get the A grade mark uses a strategy that takes advantage of the perfect layout that I introduced in my previous presentation as a framework. It consists of a 4-part strategy, which uses the maximum out of the 45 minutes allocated in the exam time. So what's this 4-part strategy to help you ace the writing subtest? It's scan, plan, write, and review. Scan is done within the first 5 minutes, so reading time. And what you do here is you plan for the middle inside your head before you start writing. And then in the second 5 minutes, or the first 5 minutes of writing time, what you do is you start highlighting all the important notes in your case notes and in the task prompt. And then you write a plan for your letter using the S-bar structure. Next, you spend 30 minutes writing out your letter. Then finally, you fix all your mistakes in the review section or the last 5 minutes of your exam. Next, I'm going to give you an overview of each stage by telling you why each stage is important, what you do in each stage, and how to do it. So why is scan and plan, the first 2 parts of my strategy, really important? Well, they help you acquire marks in these 3 assessment criteria specifically, which is purpose, content, and organization and layout. So what do you do in scanning, the first part of this 4-part strategy? Well, there's 3 things you mainly need to do. And the first part is reading the task prompt and identifying the following. Who are you? And then, to whom are you writing to? This is referred to as the reader by the assessment criteria. And then finally, why you're writing to them, or the purpose as it's referred to. Next, you read the case notes, and you identify all the specific case notes which are important and relevant to the reader, because they help him or her continue care for the patient. This is referred to as the purpose expanded by the assessment criteria, and will make up the bulk of the B section of the S-bar communication tool. If you don't know what S-bar is, I'll explain it later on. Next, which is almost as important, is identifying all the irrelevant information within the case notes. It's guaranteed the examiner would have inserted some case notes which are totally irrelevant to the purpose, and the whole purpose of inserting this in is for you to identify it and omit it. It's best you make a mental note of it now and mark it later on. Finally, what you need to do is organize all the relevant points you've identified within the case notes and organize it into paragraphs using the S-bar tool. Since you can't write in the reading time, what I personally do is take an imaginary phone call with the reader and organize it in my head. So a lot of the things you do in scanning are pretty self-explanatory, but I've highlighted 2 things which require further thought, and I'll go into further detail in how to do them. So how do you go about finding the purpose for the letter? Well, the purpose is the reason why you're writing the letter in the first place, and it's given in the task prompt. The OET website says the task can be of 1 of 3 things, and they are letters of referral, transfer, or discharge. There's also a 4th type, but it's not given in exams for doctors and nurses. However, when you're scanning and planning for your letter, I want you to forget about these 3 briefly, because it causes confusion when you want to order the importance of paragraphs. Rather, I want you to plan as if there is only 1 type, and that's a letter where it enables the other healthcare professional to continue care of the patient. It may also help you to think about it like this. There are letters where you ask another healthcare professional to continue a part of the care, and these are letters of referral, where you ask a healthcare professional to see a brand new patient for a specific indication. The other 2 letters, transfers and discharges, is where you ask a healthcare professional to continue the entire care of the patient. So now you know how to find the purpose within the task prompt. Now I'm going to teach you how to organize all the relevant points into paragraphs. And for this, we're going to use the S-bar method. The SBAR method is an accepted communication tool throughout the healthcare profession. So this is really going to help with the clarity of your letter and help you write a letter that best enables the continuation of care for your patient. Situation. This is really the same thing as purpose, and it's the reason why you're writing the letter in the first place. It's usually the first paragraph of the writing stage and can be written as 1 or 2 sentences. If the matter is urgent, you really need to mention it here. Background, or the B part of SBAR. Background really is a summary of all the problems and care a patient has received up until this point that's relevant to the reader. Keyword is relevant. So how do you know it's relevant? It helps him or her continue care. So you organize all these relevant points and you summarize them into themes which help or assist and enable the continuation of care. An example of such arrangement of themes are history and diagnosis, management, and current problems. But there's various ways of organizing these points. The arrangement of these themes can be written from most importance to least importance, with each theme being written into a paragraph. The OET website says relevant points raised when expanding on the purpose can be done thematically or chronologically. But remember, it's a big mistake to write all the case notes into a chronological summary because you're going to include irrelevant information. Instead, it's always safer to write your paragraphs according to themes. But yes, it's also okay to write these themes in a chronological order. An example of such a structure is before admission, during admission, and the current problems and management. Assessment and quest, the final 2 parts of SBAR. This really is the final 2 sentences of the middle part of your letter. Assessment. Assessment is your professional opinion why you needed to refer, transfer, or discharge the patient. For referrals, you need to give your opinion why you needed to escalate the care of the patient. For example, Mrs. Jones's past history of multiple acute coronary events requires her to be evaluated prior to surgery. For transfers, you need to give your opinion why or how your patient needs to be cared for in another unit at this point in time. Discharges, on the other hand, are self-explanatory. The in-ward management is over and the patient can be sent home. Requests. Requests request the reader to help continue the care of the patient. This needs to be polite and formal. At the same time, requests should be specific. See these 2 examples. Please kindly see the patient and do the needful. Or, please kindly evaluate Mrs. Jones's cardiological status and provide your expert opinion on cardiac risk due to surgery. You can see here how the second request is polite, formal, and specific, and it really helps the reader understand what is required of them, whereas the first request doesn't really give any direction as to what the reader must be doing. So what do you do in the planning stage, and how should you do it? In the planning stage, what you do is all the thoughts that you gathered in the standing stage during reading time, you should write down into a plan. So firstly, mark down all the important points that you found in the task prompt. This includes the task or the purpose, the reader's details, your details, and the date. Next, make an outline for each theme and paragraph that you would include in background of SBAR. After this, mark all the information that you found were relevant to include in the letter within the case notes. Then, place a number to each case note according to which theme or paragraph you intend to include it in. After that, lightly cross out or put a cross next to each bit of information which you think the examiner has inserted to be intentionally irrelevant to the letter. So you make sure that you won't include it in the letter when you're writing. Finally, write down your assessment and request in short form. So what do you do in the last 2 parts of the 4-part strategy? Write and review. You should be really starting your writing using the perfect layout that I introduced in my last presentation. So you start with the header and the subject, and this really should be done quickly using the 6-point checklist I provided. The 6-point checklist allows it basically to become a copy-paste job. Next, you move on to the middle, and to write the middle, use the SBAR structure that we just discussed. You start off with the situation, which is the purpose, then you move on to the background, which should become the largest part of your letter. Next, you follow up with the assessment and polite request. And then you end the letter with the formal and polite closing. Once you've finished, you should have about 5 minutes remaining at least to review the letter. This is time that you should use to polish your letter and maximize the possible marks available. You should identify any common mistakes you have and check any errors in language such as spelling and punctuation and grammar. So how do you go about writing and reviewing in order to get marks? Really, what is assessed in writing and reviewing is the 3 other assessment criteria that we have not discussed yet, and that is conciseness and clarity, genre and style, and language. These 3 really assess your basic English skills, that is, your ability to write. So the best way to improve these things is by writing practice answers again and again and getting feedback and corrections, and then writing again. So in this slide here, we again see the official document provided by OET for the assessment criteria of the writing subtest. And I've highlighted the 3 criteria that makes why writing and reviewing important for getting marks. We'll cover each one by one. So how do you get marks for conciseness and clarity? Well, this assessment criteria mainly assesses if you have avoided writing irrelevant and or empty words within your letter. Aspects which you need to consider in this regard is the length of the letter. OET says there's no word count, and every letter should be automatically the appropriate length if you only use the relevant points and concise language. Next, they check whether you summarize information effectively, and this usually means grouping related case notes together or contracting the level of detail given in the case notes where appropriate. Next, they check whether if you've presented your letter clearly, and this means no irrelevant case notes in the letter and no sentences that do not help on expanding the purpose. Finally, you also need to avoid including information already known to the reader. An example of this is writing about the past medical history to a GP when you're discharging a patient. So once you've finished writing the letter, you should use review time to see whether what you've written is clear to the reader and edit where necessary to help improve conciseness and clarity. So in the genre and style assessment criteria, a couple of things will be assessed. First of all, your language should be appropriate to the reader and their level of knowledge. So that means that language used for communicating with a doctor or another healthcare professional should be more technical compared to when writing to a patient. Next, when assessing style, your language should always be polite and formal. Here are some instances where you should be using polite and formal language. When you're referring to a patient by name, you should be referring to them as Mrs. Jones rather than Elizabeth. You should also avoid contractions such as don't and won't and use their full form such as do not and will not. In regards to abbreviations, you should avoid them at all costs, or it should be used very minimally. You should also be using polite and formal language wherever possible. Examples are, when you start off with your purpose, you start off by saying, "Thank you for seeing Mr. X." And then when you state your closing statement, you should be saying, "Yours sincerely," instead of "kind regards." In all instances, you should be using salutations and surnames, unless the patient is 16 years old, where you can use the first name. Once you finish writing your letter, at the end, the last 5 minutes, you should be reviewing your letter to check whether if your language can be more formal in all areas of the letter. Another aspect that's assessed is using objective language instead of subjective language. This means your writing style should be non-judgmental and it should state facts rather than opinions. Lastly, they expect you to use the passive voice instead of the active voice because they want you to prioritize the patient. Here I've given you 4 examples. The first example, "I ordered an ultrasound on Mrs. Jones," is an active phrase. You're saying what you've done to the patient. The second phrase, "Mrs. Jones went to an ultrasound scan," is also an active phrase. It tells what Mrs. Jones did. Next, "an ultrasound scan performed on Mrs. Jones is more preferable." This is a passive phrase. It says what was done to Mrs. Jones, and what was done here, an ultrasound. Better yet, here's another phrase, "Mrs. Jones' ultrasound scan done on the 1st of the 1st 2022, revealed. This is a passive phrase, and it also summarizes the finding of the phrase. So the final criteria, language, which is assessed in the writing and review phase, is language. In language, you really assessed on your basic English skills, which is spelling, vocabulary, grammar, punctuation, and sentence structure. Everyone has their own style, so you have to develop your own as well. Spelling, vocab, grammar, punctuation only improve with active learning. This means practice writing answers and then getting someone to give you feedback, and then writing again. So that's my 4-part strategy to help you unlock an A-grade response for the writing subtest. So I have some final words regarding the writing subtest, and that's always remember to use a perfect layout to help you create a foundation to effectively and efficiently scan, plan, write, and review your letter. And always remember, the first priority is to help the patient and address their needs, and the second priority is to help the other healthcare professional to maintain the continuum of care. I hope you found this helpful. Coming up, there'll be a live walkthrough where I use my own strategy to show you how I formulate a response to a task prompt.